Welcome back to Today's Health. In this segment, I'm speaking with board-certified medical oncologist, Dr. Samir Alsawah. Dr. Alsawah, thank you for joining us today.
Thank you for having me.
Now, Doctor, how is the Karmanos Cancer Institute at McLaren Port Huron enhancing the cancer care that we deliver to our patients?
There's a number of ways to answer that. Karmanos is at the top of standard for cancer care across the country. There are about 46 or 47 what we call Tier 1 or Level 1 cancer centers in the country, identified by the National Cancer Institute. Karmanos is one of them, and we're fortunate to bring the same standard of care to our patient in the Blue Water area. It offers not just the standard of treatment, but offers some enrollment in clinical trials that is only available to cancer centers such as Karmanos, which is very, very exciting. Doctors at Karmanos or affiliated with Karmanos in the communities, such as our community, will have to meet the same rigorous standard of care, standard of knowledge and practice as a physician down at Karmanos. So it would be very exciting and very, very helpful for our patients in our community.
Now, at the Karmanos Cancer Institute, what is involved in developing an individualized treatment plan for cancer patients?
And that's what makes them like a shining star. Basically, you look at the patient, not just a disease on a piece of paper, just identified. You look at the patient with a disease that involves the physical well-being, mental well-being of the patient, of the family, of what goes on, of the entire family dynamics. And so it's involved multidisciplinary approach to each case. For example, instead of fragmented health for breast cancer, for example, where the patient and the family have to travel to see different specialties at different times, at different areas, where you can all get together and identify what's the best treatment plan for the patient, and then also identify what else we need to do to help the patient at home. What else can we do to help the family, help the children, help the mother and the father? It's put a comprehensive approach to treating not just an individual, but the entire family that's affected with the disease.
Wow, that's great. Now, you mentioned earlier clinical trials. What is the benefit of having research directly involved and related to clinical treatment?
Well, the way we found the standard of care or a treatment that we have today is by having done clinical trials in the past, which some of it is like at the basic level of trial, which is what a lot of patients believe clinical trial is being a guinea pig. It's not. We have identified a lot of drugs and a lot of treatment approaches over the last 25 years or 30 years that had made a tremendous revolution in the way we treat cancer and look at cancer. But sometimes we're not exactly sure in what combination we should use them, in what order. So there's a lot of trials to try to put together a treatment plan, and we have to try and error to make sure that this is the right thing to do. And previously, all of that has been available only in major cancer institutions, which is great, but now we're so excited that something like that would be offered to our patient in the area. Plus, there are a lot of newer drugs or treatment approaches that are only available to selected cancer centers, including Karmanos. And we are so excited that our patient can enroll in those clinical trials as well.
Doctor, what are the most common types of cancer that you treat?
It's the most cancer that most every oncologist would see. I don't think our area has different prevalence of other cancers, but mostly for women would be breast cancer and lung cancer. Incidence of lung cancer continues to be on a rise in women. In men, sort of leveled off. So in men, we see prostate and lung, and women, we see breast and lung.
What treatments are available for breast cancer?
A lot of approaches. If you go back in time like 25 years, the only thing was available was simply a limited surgical approaches, a limited few chemotherapy drugs, and an old-fashioned radiation, which many of these were kind of quite difficult and quite toxic. Things have changed so much. Now not only we have those, but even within the surgical approaches, and there are a lot of new surgical techniques that were identified. Let us do a smaller operation with better results, but the patient will tolerate it much better, much less complication. Radiation oncology made huge improvements, and now we can achieve very effective radiation treatment without side effects. Chemotherapy have changed tremendously, but more excitingly, there are newer approaches such as immune therapy, targeted therapy for cancer patients, especially breast cancer, which by itself made a tremendous improvement in outcome of women with breast cancer.
Can you tell us a little bit more about this immune therapy?
Immune therapy, you'll be have an antibody, just like a vaccine. It will target only a small molecule that's in a cancer, effectively, which is more effective, but still sparing the body and sparing the person a lot of side effects. So not only is more effective, but it's so much easier to tolerate. And we started to see a lot of immune therapy treatments for other cancers as well, but for breast cancer in particular, the drug called Herceptin, which was by itself made a huge improvement in survival for women with breast cancer.
Wow. Now, what treatments are available for lung cancer?
Again, lung cancer, the most exciting news is having targeted therapy and trying to make a regimen or a treatment approach for each cancer. Not too long ago, we used to look at lung cancer as, this is it. You have the same treatment for all kind of lung cancer. Well, we found out that not all cancers are the same. So we study the molecular biology of each cancer separately, and we know exactly what works for that cancer and what does not work. So allow us to use treatment that are more effective, and let us avoid drugs that are totally ineffective. We didn't know that. We used to use a lot of drugs that we used to think, well, yeah, they're very effective. Turn out that they're not at all. Not only they're not, they can be detrimental to certain cancers. So things are changing, but also newer approaches, immune therapy, such as drug called nivolumab or Opdivo, or a lot of other drugs that are being introduced. In addition to radiation oncology, now they can do like what you call a stereotactic radiation, where they can aim at the target and literally just zap the target with a great effectiveness and unbelievable results, and still the patient suffers very little in a way of side effects. And very exciting.
It sounds like there's been a lot of great advances in the treatment of cancer. Doctor, this has been great information. Do you have any closing comments for our viewers?
I am extremely excited that I will be part of McLaren Port Huron Cancer Institute in collaboration with Karmanos Cancer Institute. It's this amazing opportunity for us in a community to provide such quality cancer care and different approaches to cancer care, and what we can do to our patients locally, which we couldn't do not too long ago. And it's a great, great, great improvement for our cancer care in the area. So it's very exciting.
Dr. Alsawah, thank you for joining us today.
Thank you so much for having me.
Stay with us. We'll return after this break.